Welcome to this first video that is going to be part of the long-term conditions series. Today's topic is going to be about chronic pain, which itself is a challenging presentation, causing significant distress to patients, and it's often poorly managed. There's many components to managing chronic pain well, so just to manage your expectations, it's highly unlikely that a single video is going to make you a master in managing chronic pain. But, the aim of the video will be to hopefully give a better understanding about what it is, the differences between chronic primary, chronic secondary pain, and what NICE actually advises our approaches to be between the two. The consultation itself is probably going to end with encouraging and empowering your patients to employ self-management techniques. So it's important to build skills that allow you to facilitate this. I'll share some useful resources at the end, not only to share but also to look into yourself, and briefly touch on the context of the next video. As with all the other videos, please take a moment to read this educational disclaimer by pausing the video. And very shortly we'll now proceed with the rest of the content. So, it shouldn't be a surprise that pain is common. It's unpleasant, we've all felt it, and quite often patients seek a way to alleviate or improve the pain, and depending on how well informed they are, it might be through addressing an underlying physical condition or considering analgesia. We will discuss the effectiveness and evidence behind the use of medication in chronic primary pain, and how there is a potential loss for follow-up and eventually overall poor management of the symptom if these things are not handled well early in a patient's journey. Now obviously pain is very disabling, so a lot of the approach towards this will focus on communication skills, empathy, but also having a good understanding about how you can make changes to a patient's life to support their symptoms and improve it. By the end of the video, we should all be able to understand what is meant by chronic pain, have a better understanding of how to assess it, and also to improve your confidence with discussing management and counselling on self-management strategies. As I've explained, this video itself is an introduction to chronic pain, which means there should hopefully be some further videos and details to see how we can actually specifically focus this into our practice. There are many definitions for pain, but what is consistent between all of the resources that you look at is you'll find that chronic pain itself is defined as a symptom that persists or occurs for 3 months or more. There should be a brief understanding that there is a pathway in the body for detecting and interpreting pain signals, but what isn't as objective and clear-cut is the impact of psychological and social factors on pain itself. And it's definitely very obvious and clear that both of these things can strongly impact levels of pain. So with this in mind, it all suggests that our assessment and management approach should be similar, i.e. using not only just a biological model, but perhaps a biopsychosocial model, a term that you're hopefully familiar with. The goal of a consultation, whilst it is very important to ensure that you're excluding red flags, but the plan should not just end following its exclusion. Excluding red flags should then help move on to focus on the rest of the patient's care to manage the symptom itself. We often consider addressing reversible factors that may exacerbate the pain, alleviate the pain, but what is quite hard to do is acknowledging how easy it is to provide advice on managing the pain. Now, the crucial part is how the patient takes that information, adapts their daily life, following just a few lines of speech that you have brought up in a 10-minute consultation. This is advice that you are potentially expecting to be followed immediately and perhaps for the rest of their life to avoid the pain. Even saying that, it just doesn't sound very realistic. So it's probably important to also have a better understanding of the impact of the symptoms, which is where parts of the history will focus on, how the pain affects the individual's life, how it affects those closest around them. Um, and it's a very hard thing to balance between focusing on those aspects, but also when to remain vigilant and not always assume that the cause of pain may remain the same for the rest of time. That's, I guess, where your experience and clinical knowledge will help you identify when is it appropriate to focus on red flags and when is it appropriate to focus on the symptoms. What you may find useful in an initial assessment is to be able to document an objective scale or on a subjective scale how severe the symptoms are for the patient. Perhaps when you follow up, you may be able to demonstrate effectiveness, or rather lack of effectiveness, of initially proposed management strategies when having that initial discussion of the management plan. And if there is improvement, this can have many positive implications. And you will have evidence yourself to show and demonstrate the importance of continuing your plan. When acknowledging a patient's symptom, it is best to get a bit more information about the current situation before suddenly expressing a whole barrage of statements to demonstrate empathy. If a patient simply says, "My pain is very severe," and then you enter the conversation and then say, "That must be very hard for you," you don't actually know the story, so perhaps you may need to listen more or gather a bit more information. There is no set in stone assessment for what information you should be able to gather, but once you have done your information gathering, you should feel comfortable with having an understanding about the current situation, the impacts of pain itself, and understanding the patient views of what they think will help them, what has already helped or hasn't helped, and how you can move forward. Unfortunately, as part of life, we are going to see or experience failure or a lack of improvement. So it's very understandable to see frustration and difficulty when there has been limited improvement despite following an initial plan. It's very important to encourage positivity, providing regular support. These things can still improve quality of life even if pain levels remain unchanged. As GPs, as doctors, as clinicians, we manage uncertainty ourselves, so we should also be in a position to communicate this to our patients. Now, it is a very good skill to be able to explain a set of conditions that do not have any obvious cause, despite numerous or persistent investigation. We've already mentioned that a key part of managing chronic pain is acknowledging that the symptoms are real. So we need to be able to effectively communicate and describe the condition that we are treating. If you'll find that you're struggling with this is where you can use resources to support your communication. So, chronic primary pain. It's very clear on this slide that there is no diagram for the pain ladder. And that's because non-pharmacological strategies are proven to have stronger evidence for improving symptoms over analgesia. Now, NICE suggests a few things such as counselling, acupuncture, supervised exercise groups. Now, this is where it becomes important to find out how you can provide these to patients, whether it's signposting them to a local leisure centre, a local wellbeing walk. These all count. But it's also important to be able to explain how effective these things are. Because whilst you can make recommendations, you can sometimes have patients that will either completely follow your advice or sometimes question the effectiveness of what you have suggested. Either way, you should ultimately make a shared decision on the next steps. There is a role for antidepressants in managing chronic primary pain. but its use is what we describe as being off-label. That essentially means that the medication does have a license for its use, but you're not using it for its usual or typical indication or age group. It's still a regulated medication that is quality assured, but as a prescriber, have a discussion about the risk and benefits and obviously document the consent for its use. This would be a good time to start looking at the links that have been shared in the video description. Now, the first resource that I'd like to talk about is the Decision Aid for Chronic Pain. Now, it's structured into 3 sections, exploring how the symptoms affect the patient's life. So remember how we talked about getting an objective or subjective description about the severity. This document supports the patient in going through that assessment, but also providing different options on how they can manage their symptoms and how they would like a clinician to help support them or signpost them to a particular management strategy. It's got a nice summary at the end for a whole bunch of resources, more than this in fact, to see what resource is good for a patient, because you can suggest many things. You might find it useful, but another person might not, for example. Another tool or website, now unfortunately it's not completely accessible based on where you live, as it is a community resource, I believe, that is published for patients living in the Midlands. But there are certain sections within the website that have videos and audio recordings in English, Urdu, Punjabi. Although it's quite a niche resource, it is something that you can have a look at and see, is it something that can support my consultation. And also another website that's called Live Well with Pain. We talked about self-management strategies, and this is a very, very good website to signpost the patient to start that journey if you feel that you're unable to do so in the consultation time or experience that you have. There are a few true stories or cases that explain the effectiveness of what they call the 10 footsteps to living well with pain. Now, we've already acknowledged that not everything works for everyone, but there is no doubt that there will be something useful. So, if you have a bit of time afterwards, have a quick flick through these resources. There will be more. Find what works well for you. These are just some that I thought would be useful to share myself. So, clearly we've understood a bit more about what chronic primary pain is and how we should assess patients who experience it, but we should probably endeavour to discuss a bit more about how we can support patients with self-management strategies, and that's a learning need for me. So I need to take some time, look into what I find would be effective, what those who are more experienced or trained to deliver coaching say or encourage. Either way, these are all things for a future video. Thank you for listening either way. Please have a look at the resources, and I will see you next time. But please like and subscribe before you go.